Hello friends, in the current video I am going to explain you about the topic of diabetes mellitus. It is a condition, it is a metabolic condition. So let's begin. Uh, First start with what is the introduction of diabetes mellitus. Diabetes mellitus is a group of metabolic disorders which are characterized by high blood sugar level over a prolonged period. It means that diabetes mellitus is a group of it a group of metabolic disorders. It will have so many symptoms included in it, and it is characterized by and mostly what we see here is that whoever the person who are having diabetes mellitus, they will have a increased level of blood sugar, and it is increased level of blood sugar, and it is for over a prolonged period of time. Means if once a person is checked their blood sugar level, it doesn't mean that if it is high, it doesn't mean that they are having diabetes mellitus. If a person is having a high blood sugar level for a prolonged period of time, it means that once, twice, thrice, if you check and continuously the person's blood sugar level coming high, then we conclude it as a diabetes mellitus. And it is mainly characterized by seeing the blood sugar level of the person. We identify diabetes mellitus, and diabetes mellitus comes with groups, a set of metabolic disorders, but mainly it is characterized by increased blood sugar level in the person. And now let's see what are the types of diabetes mellitus. Mainly introduction is enough for the people or for the patients, but for medical professionals we need to understand what are the types of diabetes mellitus and in detail what it means. So diabetes mellitus is divided into four types mainly. One is type 1 diabetes mellitus, another is type 2 diabetes mellitus, we call it as type 2 diabetes mellitus, and another type of diabetes mellitus is gestational diabetes mellitus. Okay, gestational diabetes mellitus mostly present in pregnant women who conceive a child. They, if their blood sugar level is more, then we call it as gestational diabetes mellitus. And besides that, there are some more other type of specific types of diabetes mellitus depending on the conditions of the patient, age of the patient, and other depending on other circumstances. So so these are the main types in which diabetes mellitus is divided. So now in this topic we will study in detail about what are the few important types of type 1 and type 2 diabetes mellitus. So let's understand what is the difference between type 1 type of diabetes mellitus and type 2 type of diabetes mellitus. Type 1 diabetes type 1 diabetes, what is it? An autoimmune condition where the immune system attacks insulin producing cells in the pancreas. We all know that pancreas produce insulin in our body, so which plays a key role in the controlling of the levels of sugar in the blood of an individual. So in the condition of type 1 diabetes mellitus, what happens that it attacks the insulin producing cells. There are a few cells present in our immune system in the pancreas which produce insulin. So those cells of the pancreas, they get affected, they get attacked, leading to increase or decrease in the production of insulin in the individual, and it leads to type 1 diabetes mellitus. And it is an autoimmune disorder. Means if a person their own immune system develops this kind of condition, they attack their own pancreas cells, which result in decreased level of insulin production by the specific pancreas cells, and it will cause high level of blood sugar in the individual, and it leads to type 1 diabetes mellitus. As it is an autoimmune condition, it is also genetic. If their parents, it's present in anybody's family, there are more chances that they develop this autoimmune condition, and more there is a chance of their producing type 1 type of diabetes mellitus. And age also plays a key role in some because of the increased age, or 40 plus age mostly nowadays, because of their age also, their autoimmune condition becomes uh, becomes not working properly. Because of that, it attack their own insulin cells, which will result in less production of insulin from the pancreas, and leads to diabetes mellitus of type 1. And another thing is, it requires insulin therapy for management. Type 1 type of diabetes mellitus always require insulin, because the pancreas cells, which have to produce a certain set of insulin, is a hormone, right? As the pancreas cells, or the pancreas organ, part of the organ, is unable to produce the required amount of insulin, because of that the whole body system and whole body function becomes defective. So because of that, to restore that, from outside, insulin therapy can be given. If the required set of insulin body receives out from outside, there are different types of insulin nowadays available, which can be natural insulin, and another is artificially made insulin. So if those insulins we injected in the individual, the patient, the required amount of insulin demand will get sustained, then it will lead to normalcy of the blood sugar level of the person. So mainly it require nothing from the outside, but just insulin therapy to restore the desired amount of insulin from outside. Then it leads to proper functioning of the body, and it will control type 1 diabetes mellitus. Now come to if what in type 1 type of diabetes mellitus, what happens that the person will become insulin dependent for the next of the time, next of the life. It becomes compulsory for them to take insulin shot regularly to maintain required dose, as their body is their self unable to produce type 1 type of unable to produce insulin, then these patients will become chronic patients of diabetes mellitus. And for them, from the day they have type 1 type of diabetes mellitus, for the years together they need to take insulin. It will become a chronic condition in those patients. Now come to the next type of diabetes mellitus, type 2 type of we call it type 2 diabetes mellitus. So what is the difference between type 1 type of diabetes mellitus and type 2 type of diabetes mellitus is, type 1 in type 1 type of diabetes mellitus, insulin production is hindered because of the pancreas cells not producing the required amount of insulin. But what happens in type 2 type of diabetes mellitus is that it is characterized by insulin resistance and relative insulin deficiency. In these conditions, what happens? A type 2 type of diabetes mellitus is a condition in which insulin resistance develops. It means the body is producing, pancreas is producing the necessary amount of insulin, but what happens is that the cells which need to it's not there may be a condition, it's not reaching the blood stream, and it is unable to control the blood sugar level of the person. And it not gets absorbed in the blood properly, not gets absorbed in the cells properly, then it will lead to it is unable to even though the insulin production is right, but there is a resistance. Insulin is whatever the insulin produced in the body, it is unable to control the blood sugar level of the individual. In that condition, it will lead to type 2 type of diabetes mellitus. It is often associated with obesity and lifestyle factors. So mainly where we can see type 2 type of diabetes mellitus is those people who take most amount of fast foods, cheese, fatty foods, and they don't do exercise, they have a sedentary lifestyle. In those conditions, in those people, they will develop type 2 type of diabetes mellitus. In those patients, the pancreas of the individual is working properly, there is no problem with that, but the thing is that whatever the insulin produced in the body, that insulin is, because of some reasons, they are unable to control the blood sugar level of the individual, blood sugar in the blood, and it will lead to high blood sugar level. It will, we call it as type 2 diabetes mellitus. Now now the third, these are the type 1 and type 2 type of diabetes mellitus. In type 1, pancreas cells required amount of insulin production not done. In type 2 type of diabetes mellitus, even though the insulin production is proper, but the thing is that it is unable to control the blood sugar level of the individual. So these are type 1 and type 2 type of diabetes mellitus. Now come to a different type of diabetes mellitus, which is called as gestational diabetes mellitus. So what is gestational diabetes mellitus is that it occurs during pregnancy. It is mostly seen in pregnant women, and it is typically resolves after birth. And if resolves after birth, means it don't stay in the woman for even for years together. The thing is that during the period of their till they are carrying the child and till the childbirth, they will show increased level of sugar in their body, and soon after the birth the symptoms and the blood sugar rise subsides, and there won't be any diabetes mellitus in the patients. But during the time of pregnancy, there is a need for the management of this type of gestational diabetes mellitus, because it will lead to complications in the pregnancy and fetus. So it needs to be managed properly. Managed properly. And another thing, increase this risk of developing type 2 diabetes later in life, and though it will increase after in those women who had a gestational diabetes mellitus while carrying the child, there is a more chance that they develop type 2 type of diabetes mellitus. So whatever the diabetes mellitus those women show after the child, even though after the childbirth, if they are showing the symptoms, if they are having diabetes mellitus, we don't call it as gestational diabetes mellitus, we call it as type 2 type of diabetes mellitus. And again, it is related to the lifestyle of the woman, and it is again related to the diet of the woman. So we call it gestational diabetes mellitus. And now come to the other specific types of diabetes mellitus. It includes genetic factors, diseases of pancreas, and drug-induced diabetes mellitus. So there are some other types of diabetes mellitus also, which we are narrating here in short. So they are genetic defects. If a few individuals they have some genetic defects, then irrespective of their age, there is a chance that they develop diabetes mellitus at any age. And some diseases of the pancreas also, it will as pancreas plays a crucial role in the production of insulin in our body. Then what happens, if any defect happens, any disease happens to the pancreas, it will directly or indirectly affect the insulin production and will lead to that type of diabetes mellitus. And another thing is drug induced diabetes mellitus, because of few drugs also. If they have side effects, there is a chance that it will result in a abnormal blood sugar level of the in the individual, and it will call that type of drug induced diabetes mellitus. So now we will study about what are the now we will see and understand what are the causes of diabetes mellitus. So first thing is genetic predisposition. Genetic predisposition, it means that if a family, in the family they have a genetic history of having diabetes mellitus, then it will there are more chances that their family members, other family members also will get diabetes mellitus. Another thing is environmental factors. Environmental factors if includes that if they live in a environment that where they do less walking, their lifestyle is in such a way that they can't do exercise, can't do more metabolic activities, then it will lead to it will cause that type of metabolic factors, environmental factors, which in turn will lead to diabetes mellitus. Because most of the time here nowadays people, their work culture is that they have to work for long hours, they have to sit and work. Because of that thing also, it will again result in a kind of sedentary lifestyle, and it will, because of those environmental factors, because they don't have more time for exercise and more time to have a healthy food. Because of that, because of those things, there is a chance that they develop diabetes mellitus. And another cause of diabetes mellitus is obesity and lack of physical activity. If there are BMI is more than the desired level, and they are individuals are obese, they don't do physical activities, then there is a more chance that they will develop diabetes mellitus. Mostly in this mostly obesity and lack of physical activities, as we learned, develop type 2 type of diabetes mellitus. And what environmental factors also will lead to type 2 type of diabetes mellitus. But in a genetic disposition, because of the genetic disorders, there is a chance that the individuals develop type 1 type of diabetes mellitus. And autoimmune destructions. Autoimmune destructions type 1, because of the some of the autoimmune diseases also, it will result in autoimmune destruction. Because of those autoimmune diseases, there is a chance that those individuals who have some autoimmune defects, diseases, they develop type 1 type of diabetes mellitus. Mostly in type 2 type of diabetes mellitus, it is advised to the patient that they do regular exercise, they take healthy foods, and this is commonly advised. And those individuals who develop autoimmune destruction type 1 type of diabetes mellitus, there is no other option that insulin is prescribed to those patients. Now in this slide we will learn about what are the symptoms of diabetes mellitus. So mostly we see a patient will come and they will complain about frequent urination. They will say we have to go to urine for more than 2 times, 3 times, 4 times. We have to go to the urine. Their family members also who come with them, they inform that these individuals they go to urine frequently or most of the times. Then it is a symptom of diabetes mellitus. Then excessive thrust. Those individuals, they will have excessive thrust. They take more water, and so they even what happens that this is usually we advise people to drink water. It's the thing. But those people who have diabetes mellitus, it will be a kind of symptom for them. Why? Because after drinking water also they feel thirsty again. After drinking water they say we are getting thirsty and we are not feeling means continuously after drinking water also we are feeling thirsty, and frequently we have to go to the urine, and it create a kind of uneasiness in their life. So then we have to do test for blood. We have to advise them blood sugar, you have to get it checked, and then proper medication if they receive, then these symptoms will subside, and there will be a relief in the patient after that. And unexplained weight loss in a type of diabetes mellitus, we see mostly in type 1 type of diabetes, usually blood loss is seen, because whatever the blood sugar in the blood, it is unable to absorb by the cells. So the cells, even though the blood sugar level in the blood is more, but the cells of the body face lack of sugar, and it will leads to weight loss. Therefore, because of the lack of sugar in the cells of the individual, they lose weight continuously, and they become thin. And fatigue, because fatigue is also a symptom in both in type 1 and type 2 type of diabetes, because diabetes mellitus, because of the lack of proper glucose in the glucose utilization in the body. So they will feel fatigue. Blurred vision, blurred vision is also symptom of diabetes mellitus. Their vision won't be proper, it will become blurred. So because it is because of the condition of diabetes mellitus. Now how to diagnose diabetes mellitus in a patient? Fasting blood sugar, blood glucose test. Mostly fasting blood glucose test we have to do. And if it is more than the normal limit, then we conclude it as a diabetes mellitus. Then oral glucose tolerance test, it is also type of test in which through which we can come to a conclusion whether the individual is having diabetes mellitus or not. Hemoglobin A1C test. Hemoglobin A1C test is also a test. We have to draw blood sugar for the patient, and we have to send the sample to the pathology, and there they will show the report. Because of that, with that we come to know that how this person is having diabetes mellitus or not. And a random blood sugar test also can also be done. If any individual is having more level of blood sugar and than normal, then in random blood sugar test also we can diagnose whether an individual is having diabetes mellitus or not. Because few patients, they have a sugar level more than 200, so in those patients random blood sugar test also can also conclude that a person is having diabetes mellitus. So these are the tests: fasting blood glucose test, oral glucose tolerance test, which is in short known as OGTT, hemoglobin A1C test, and random blood glucose test. These are the tests we need to do to know individual is having diabetes mellitus or not. Now we will see what will be the complications of diabetes mellitus. Why diabetes mellitus need to be managed? And why? Because if it is not managed, it will result in further breakdown of the breakdown in the other systems of the body, and it will result in abnormalities in other systems functioning. So diabetes mellitus need to be managed, because otherwise it will affect cardiovascular, it will lead to cardiovascular diseases in the individual. It can also lead to neuropathy means in few individuals, few patients, they may develop the symptoms of cerebrovascular strokes, cerebrovascular hemorrhage and bleeding. They can develop the these type of conditions, and nephropathy. Their kidney also get affected in some conditions. Retinopathy, as we see, as we came to know that blurred vision is mostly result of diabetes mellitus. It will also affect the retina of the patient, and uh, their vision, there in most severe cases there is a chances that few uh, diabetes mellitus patients, because of their condition, they experience loss of vision. And foot ulcers also mostly seen in mostly diabetes mellitus patients. They have complaints of foot ulcers which further lead to cellulitis and other septic diseases. So foot ulcers are mostly seen in patients with diabetes mellitus and other infections. So diabetes mellitus need to be managed properly to avoid its further effect on other systems of the body, as discussed here: cardiovascular diseases, neuropathy, nephropathy, retinopathy, foot ulcers and infections. So now come to management of diabetes mellitus. How diabetes mellitus can be managed in a patient? We have to ask the patient to do lifestyle changes. We have to ask them, improve your diet, take healthy food, don't take fast foods and more fatty foods, don't take that, and do regular exercise, go for walking, go to gym or do exercise, avoid do physical activities. So we have to suggest the patient to do lifestyle changes. And next kind of management to the diabetes mellitus is medication. We have to give the patient insulin and oral hypoglycemics. Like oral hypoglycemics, we have to give the patient metformin, glimepiride. These medications we can advise to the patient, and insulin therapy also advised. And we have to ask the patient regularly monitor their blood glucose levels, so that the patient and the caretaker who is giving treatment to the patient, they know what is the blood sugar level of the individual and how much care need to be taken. And patient education and support, we have to educate the patients. Few patients, they feel more by knowing only, they came to know so many things from their family, friends, and they have a set of kind of idea in their mind about blood sugar, their condition of diabetes mellitus. So if they have any myths, any wrong information, we have to clear them. It's not that the thing, and it's not the thing. We have to provide relief, and we have to educate the patient why they are getting diabetes mellitus, what can be the complications, why they have to take treatment, why they have to do regular exercise, why they have to change, and how medical professionals can support them in treating all these. Now come and let's understand what is the importance of diet and diabetes mellitus in diabetes mellitus. So balanced diet is very much important in diabetes mellitus. They should not take more amount of rice and more amount of those food substances which will have high level of sugar in that. So they need to take a balanced diet with proper amount of carbohydrate, fats and proteins. And role of carbohydrates, fats and proteins all play how much role we should explain to the patient. If they are taking more amount of carbohydrate, then it will result in immediate increase in their blood sugar level. And if they are taking more fatty foods or more proteins, it will also lead to increase, it will also affect and there is a more chance that they will develop diabetes mellitus, or their condition may get more worsened. So what's the role of all have a role, all carbohydrate, proteins and fats have a role in the condition of the patient. We have to explain that to the patient. And what is glycemic index and its impact on blood sugar level? We have to understand what is the glycemic index, what is glycemic index, and how it have effect on blood sugar levels of the individuals, and portion control and meal planning. And we have to explain the patients how they have to control how much amount of what kind of food they need to take, and how they have to plan their meals. So what can be the timing of their meal, and what can be how many times they can take meal. It needs to be planned in diabetic patients. Now what is the effect of exercise in diabetes is that benefits of regular physical activity. There are so many benefits of regular physical activities in the patients who have diabetes mellitus. Types of exercise suitable for diabetes: mostly those people who have diabetes, they are mostly of elder age, and simultaneously diabetes mellitus, there is usually they mostly we see that they have other conditions also, like osteoarthritis or other obesity. They have fatigue, they feel they have overweight things. They have some other symptoms, other symptoms like frequent urination or thirst. They will have easily fainting, getting faint. These type of all complaints they will have. So we have to advise them according to their age, their gender. We have to advise them what are the exercises which are suitable to them. If it is gestational diabetes mellitus, then according to that also suitable exercises we have to suggest to the patient. Then what are precautions and considerations? What precautions means, what mainly in diabetic patients they always ask what precautions, what food they can take, what food they cannot take. And mostly they will ask, this food we like, can we take this food? So how much, what extent, and what extent, and where we have to do give considerations. Those things are very important in patients who are having diabetes mellitus. The amount, the how much, if they are so much keen to take that kind of food, then we have to suggest them, okay, this much amount of this kind of food you can take, because this is having this form of food content. It have this this much protein, this much fat, this much carbohydrates. So we can consider this much amount of this kind of food you can take. All of the considerations and precautions we have to explain to the patient. And next, what is the impact of exercise on blood sugar level? How we have to explain to the patient, if they are doing regular exercise, if they are doing some lifestyle changes, how it will in turn result in maintaining of their blood sugar levels, and how they help in controlling their conditions. These things we have to explain to the patients, and we have to ask them, we have to note down, we have to make an analysis, and we have to ask the patients how much time they do exercise. After checking the blood sugar level, what are the changes are there, we have to explain the patient, we have to motivate the patient, because of this exercise this much of change we can see in your condition. So it will show, and it will show the impact, and they get they cooperate more in controlling the, and in managing their condition. Now, medication for diabetes mellitus. What are the medications usually given in diabetes mellitus. Overview of insulin therapy. We know insulin therapy is mostly given in type 1 type of diabetes. If the person they are having oral hypoglycemics, for example metformin, these are in tablet forms. We give metformin, sulfonylureas, etc. And newer classes of medications are GLP-1 agonists and SGLT2 inhibitors. And we have to explain the patient, so we have to note down if the person individual specific getting any specific side effects because of particular drug, then that need to be considered. Now let's come and understand what is diabetes and how it affect mental health of that individual, of the patient. Impact of diabetes on mental well-being. It will have impact on the mental well-being of the patient, because the time the patient they came to know that they have diabetes mellitus, then it will have a huge impact on the huge impact on the mind of the patient, because usually generally by the people from the society, they know that diabetes mellitus is a long term condition. They understand that they developed a disease for which they have to take medicine for a long time. So we have to explain to those patients, it's not like that. Even though you developed diabetes mellitus, it is not the thing that we cannot control it. We can control it, and the thing is that what we have to explain them how lifestyle changes also plays an important role in controlling and managing those conditions. We have to explain to the patient. And next is stress, anxiety and depressions. Few individuals they take it as a kind of stress. Because of that condition they feel more stressed. And if any individual in their early ages also they develop diabetes mellitus, because of because they express huge amount of anxiety, because they want to know what will happen. Anxiety, we can see anxiety in the patient, anxiety in the patient attenders also. They think few patients they feel more anxious. They ask you what further tests needs to be done, what further investigations need to be done because patient is developed diabetes mellitus. So this kind of anxiety also may be present in the patient. And few patients, if some patients, it depends on the patient and their thinking, their mental health. Few patients they develop stress, few patients they develop anxiety, and if the few patients they feel depressed, they think that we got a disease and we are now diseased for next of our life, and it will also affect our this organ, that organ, this will fail, that organ will fail, this will happen, this will happen, and they feel depressed and sad. So in those conditions we have to provide mental counseling to these patients, and we have to explain this is a condition which can be managed, and what are the coping strategies are necessary, support systems we have to explain to the patient. And what is the role of healthcare professionals in mental health management? Every part of the mental health management, every person who are working in the hospital, who come in contact with the patient, they have to explain to the patient, because this is the condition and this will be the management, and they have to explain that what are the measures they can take to control the disease. So at every point of contact, all healthcare persons need to provide mental support to the patient who are having diabetes mellitus. Now, prevention of diabetes mellitus. So how an individual can prevent getting diabetes mellitus? So first and foremost important thing is in controlling of diabetes mellitus and in prevention, that the individual don't get diabetes mellitus, then they should adopt healthy lifestyle. The healthy lifestyle means they should avoid uh, every time taking vehicles to go nearby places also, they should do regular exercise, they should take healthy food, they should avoid fast food. So these are the all measures and a healthy lifestyle they have to maintain to prevent diabetes mellitus. And what is the role of diet and exercise in prevention? They should, every individual, even though they are having diabetes mellitus, they are not having diabetes mellitus, they should know and they should learn what is the diet they have to take and what kind of exercise is necessary for every individual to do to avoid diabetes mellitus. They should know, they have this kind of a health education, so that it can it then there are more chances that we prevent diabetes mellitus in individuals. And it is also important that regular screening and checking of blood sugar levels of the individual, so is also important in the prevention of diabetes mellitus. Early screening and interventions, because before getting diabetes mellitus, if it gets screened, then there are more chances that we can avoid more complications related to the diabetes mellitus. It can be managed easily and it can be regularized easily. So early screening and intervention plays a very important role in prevention and control of diabetes mellitus. And other public health initiatives and awareness also necessary. Whoever coming to the hospitals, it is necessary for them to explain and in the public health and public health intervention initiatives, public health initiatives also, other social service activities also, they have to explain individuals, family in the society also go what, and they have to explain what is diabetes mellitus. They should provide awareness about the disease. So these disease, so it will again helps in the prevention of diabetes mellitus in the individuals. Advances in research, what happens now, what are the advances presently present in diabetes research? Latest developments in diabetes treatments, there are many developments happened in the treatment of diabetes mellitus. Advances in insulin therapy, insulin therapy, there are new technologies came as artificial pancreas, continuous glucose monitors. These are the things which came into existence. Future directions in diabetes cares, future directions in diabetes cares. These are the things which are new advances which came in the diabetes, which help in the management and prevention and cure of the disease of diabetes mellitus. Now let's conclude the topic. In this topic we studied about diabetes mellitus. It is a complex condition requiring comprehensive management. It needs comprehensive management. Early diagnosis is effective what is early diagnosis of diabetes mellitus? We learned about effective treatment, what kind of treatment and what kind of treatment which can be provided to the individual who are having diabetes mellitus. What are the necessary lifestyle modifications which are necessary in the management of patients who are having diabetes mellitus or who want to prevent diabetes mellitus. What is its effect, we studied, and what are the key to preventing complications and improving quality of life. So what are the key things we need to do to prevent diabetes mellitus complications and to have a quality life? All those things we studied in this topic. So this is let's have a small revision of the topic what we studied today. Okay, today we studied about the topic of diabetes mellitus. We understand what is diabetes mellitus, how it is a metabolic disorder, and what we see here is that we see if an individual having a high blood sugar level for prolonged period of time, for second few checks, if it is persistent, then we call it as diabetes mellitus. We next studied what are the types of diabetes mellitus. We studied about type 1 type of diabetes, type 2 type of diabetes, gestational diabetes, and other specific types of diabetes. mellitus. So we here in this topic we also studied about what is type 1 type of diabetes mellitus. Mostly in type 1 type of diabetes mellitus, what happens is that the pancreas cells of the individual stop producing the required amount of insulin because of n number of conditions or n number of the factors, and it is an autoimmune condition. So which will result in type 1 type of diabetes mellitus where insulin therapy is required. And next we studied about what is type 2 type of diabetes. Type 2 type of diabetes is mostly because of the insulin resistance. Those whatever the glucose present in the blood, it is unable to get absorbed in the cells and get utilized. Then those individuals will develop type 2 type of diabetes. Mostly it is because of obesity and poor lifestyle factors. Individual develop type 2 type of diabetes mellitus. Then we studied about what is gestational diabetes mellitus. Gestational diabetes mellitus mostly we see in pregnant women, and it subsides after childbirth. And if after childbirth, if the woman develops diabetes mellitus, mostly they develop type 2 type of diabetes mellitus. It result in type 2 type of diabetes mellitus. And we studied about other specific types of diabetes mellitus also, which are developed due to some genetic defects at early ages, and because of few diseases of the pancreas, or because of the side effects or some of the drug induced diabetes mellitus that we study. Now in this slide, in this topic, we studied about what are the causes of diabetes mellitus due to genetic predisposition, because of environmental factors, because of obesity, lack of physical activities, and autoimmune destruction. Individual develop diabetes mellitus. Then we studied about what are the symptoms mostly seen in the individuals who are having diabetes mellitus. First and foremost important thing is they will have frequent urination and thirst. And again a particular set of diabetes mellitus will show weight loss, and other type of diabetes mellitus show weight gain. And mostly patients who have diabetes mellitus, all patients, they have common complaint of fatigue. They will have in severe conditions they will develop blurred vision and retinopathy. Again next we study about what are the how we diagnose diabetes mellitus. So fasting blood sugar test, oral glucose tolerance test, OGTT, hemoglobin A1C test, and random blood glucose test are the most common tests which are done to diagnose diabetes mellitus. Then what are the complications? Complications means that if an individual is developing, we studied what are the other complications a patient of diabetes mellitus can develop. They can develop cardiovascular diseases, neuropathy, nephropathy, retinopathy, foot ulcers, and infections. And again next we studied how to manage diabetes mellitus. We studied some lifestyle changes, medications, regular monitoring, and patient education and support can play a key role in managing the condition. Then we studied about most important factors which are related to diabetes mellitus and their management. That is diet, how diet plays an important role, we studied. And again why balanced diet, meal planning, portion control, glycemic index, and blood sugar levels monitoring is important in the management of diabetes mellitus. Again we studied about how exercise plays an important role in controlling diabetes mellitus. What are the benefits of physical exercises? We also studied and understood about the suitable exercises for the which are specific to the patients. Then we studied what are the medications mostly commonly prescribed to the individuals who are having diabetes mellitus. We studied about insulin therapy. We studied what are the hypoglycemics, metformin, sulfonylurase, etc. can be given. We also studied about newer classes of medication, GLP-1 agonists and SGLT2 inhibitors, and what can be the side effects and how to manage that. We studied about how to monitor blood glucose levels in an individual. we studied how it is important to monitor blood glucose level in the individual. What are the different methods can be used by using glucometer, continuous glucose monitoring. How can be blood glucose level of an individual can be checked regularly. Target blood glucose levels, we have to ask the patient set a target of this blood glucose and maintain that. We have to ask the patients to maintain blood glucose. We have to ask the patient to maintain we have to ask them frequently monitor their blood glucose level. Then again, next we studied what is the diabetes mellitus, how it affects mental health of the patient, how to manage that. And then we studied about what are the advances and presently seen in diabetic research, and conclusion. So we concluded what is diabetes mellitus, why it is a complex condition and why it need comprehensive management, how to diagnose it, how to treat it, what are the lifestyle changes are necessary in the patients who are having diabetes mellitus, how to prevent it, and how to improve the patient life who are having diabetes mellitus. So thanks for watching. For more videos, please subscribe my channel. Thank you.